When chronic kidney disease goes to stage 5, then the patients have to make choices for their renal replacement therapy. They either need to choose hemodialysis or peritoneal dialysis or transplant. The kidney transplant can be a live-related kidney transplant or a cadaver kidney transplant. But the patient has to make a choice. And going to the stage from CKD stage 1, 2, 3, 4 and stage 5. And then if he chooses to be on dialysis, either it can be a peritoneal dialysis or a hemodialysis, the diet for these patients is very important. Namaskar. This is Dr. Suniti Khandekar and you are listening to Diet and Kidney Academy's Dialysis and Diet. So let us begin about dialysis and diet. We are discussing dialysis and diet. This is Diet and Kidney Academy. I am Dr. Suniti Khandekar, an MBBS clinical nutritionist, MBA hospital administration and course director at Diet and Kidney Academy. So let us begin. So patients on dialysis need to watch their diet, what they eat, what they drink. The right kind of diet depends on the type of dialysis therapy you are on. Now, patients on hemodialysis need to watch their diet the most. Patients on peritoneal dialysis or those on home hemodialysis have fewer restrictions, though restrictions are there. And the frequency of dialysis also contributes to the dietary restrictions. Current health and comorbid conditions, if any, also contribute to the dietary factors. Now, normally kidneys filter the blood of excess toxins, water, salts and minerals. Now, dialysis is a treatment that takes up the job of the kidneys partially, not completely. So, the failing kidneys are helped, or the already failed kidneys are helped with the process or the procedure of dialysis. Now remember, kidneys work 24/7 and dialysis is taken 3 times a week for 4 hours in case of hemodialysis if we are talking. So that's a lot of difference. Now patients need to be careful about their fluid intake. So too much of fluids can lead to increased blood pressure, increased weight gain, swelling or even breathlessness. Certain nutrients need to be kept under strict control so that they do not accumulate in the blood and cause problems. Now, the dietary changes that are to be made are, when it comes to fluids, the fluids need to be limited. So, limit fluid intake in patients of hemodialysis. Any food which is liquid at room temperature, it counts as fluid. For example, ice cream. Avoid fruits with excess water content as melons, peaches, lettuce, etc. In case of proteins, muscles become strong, so protein must be taken in the daily diet. Peritoneal dialysis patients may need extra protein intake because the body loses them during the process itself. So amino acids are let out along with the PD fluid. So they need to eat an extra amount of protein in the diet. Sodium per se. Sodium is present in table salt, in preservatives and as hidden sodium also. Remember the salt water cycle thirst. Restrict salt in your diet is the advice given to patients on hemodialysis. For potassium, this nutrient affects the heartbeat, the rhythm of the heart, and it may cause arrhythmias. And that is why patients on hemodialysis need to be strictly following potassium guidelines. For phosphorus, if phosphorus builds up in the body, it can cause weak bones. It can cause other problems. It can cause irritation. Now, it needs to be restricted in case of dialysis patients, and medicines to lower phosphorus needs to be given. For more details on diet in case of dialysis patients, we have our 3 books, Indian Diets and Kidney Diseases, Kidney का स्वास्थ्य हिंदुस्तानी स्वाद के साथ, and किडनीचे आजार आणि भारतीय आहार in Marathi. Now, If you want to learn more about renal nutrition, we have our courses in Diet and Kidney Academy. Change the way you practice nutrition and you can become an expert renal nutritionist. Those who are already practicing nutrition or students of nutrition and dietetics, students who want to change and help patients who are having CKD, who are on dialysis, who want to go for transplant, students who want to change the quality of life of Indian patients, we have the first online Indian digital platform, that is Diet and Kidney Academy, which will help students, which will help patients to learn about the Indian diet perspective of Indian renal nutrition. Do think about it. Think Indian,